applying adult disposable brief. And with like every skill, you start out first, knock on the door, identify and greet the resident, check the armband to identify them. To make sure you have the proper resident, call them by name. Good morning, Miss Bobby. My name is C. I'm your nursing assistant, and I'm here to change your disposable brief. She gives me her consent. Then I will go wash my hands and draw the curtain for privacy. I'll come back. I need to raise the bed rails. And there are all types of beds, depending on where you go. And that's part of your orientation process when you get to your facility or your hospital. You will be trained on how to use the beds and the rails. So the rails are up. Now I'm going to raise the bed. You always want to raise your bed for good body mechanics so you don't stay bent over when you're caring for patients, because at the end of the day, you're going to feel it in your back. Okay, the bed is raised, and I'm going to grab my supplies. You always want your supplies close to you. I have a wash basin with washcloths in case I need to wash her. I have my disposable trash bag, my new disposable brief, the pad that's going to go under her, the bath blanket to provide for privacy, and my gloves. During this skill, I want to be very careful that this patient's skin is protected at all times to make sure there's no shearing, no friction, and no skin tears. Now, I will put the bath blanket on. When you put the bath blanket on, you unfold it onto the bed. You never shake linen because it spreads microbes. The linen is folded in quarters. The closed fold goes on the edge with the loose quarter on top. The first quarter comes off. The other 3 quarters go across. Then I'm going to ask my patient or resident to hold the bath blanket while I pull down her linen so she doesn't become exposed. And I'm going to tuck this under her shoulders so it doesn't slide down. If it were a real person, you could ask them to hold it. Pull the linen down all the way. Then I'm going to put on my gloves. You always want your gloves to cover as much of your skin as possible. So always make sure the cuffs are up over your wrist. Now I'll place the pad under the resident to protect the bed. I'm going to turn her on her side and place the pad under her. Okay. Now she's on the pad firmly. Okay, now to take off the old pad. I'm going to bring her bath blanket down. When we do the Perineal Care skills, we'll bring the bath blanket up, but in this case, we'll take the bath blanket down. I'm going to unfasten her brief. And I'm going to push the front of the brief between her legs. You want to be sure to fold it in and roll in case there's anything in there that might fall out. You don't want that to happen. Roll it under. Push the far side under her back. Then I'll roll her away from me and take out the dirty pad. Finish rolling it up. I'll place it in a plastic bag. Tie it up. And I'll just put that on the end of the bed until I'm ready to throw it away. Then I would provide perineal care if necessary. Then I would take off my gloves and raise the rail and go wash my hands. Then I would come back, put on new gloves, and get ready for the new brief. Lower the rail, get my new brief. You want to make sure that the tabs are away from the person. They're going to be under their back. Okay. So when I turn her over, the first thing I want to do is roll the pad away from her. Then I'm going to put my new brief under her. And you want to line this up by placing the top of the cotton at the top of her butt crease. And that will line it up so that your brief will be correctly positioned under the person. Because if you don't have enough in the front to bring up, then you'll have to reposition the patient again, and they really don't like that. Okay, so then I'm going to roll her towards me. Pull out the dirty pad, put that on the end of the bed, and pull out the other side of the brief. I'll bring the front of the brief up onto her abdomen. Apply the tabs. Angle them in, and the tabs for the other side. Typically, the color of the brief determines the size. So this is a medium. All right. Then I'll make sure this goes into the dirty linen hamper and my dirty bag. Take off my gloves. Discard my gloves. Wash my hands. Pull up her linen after my gloves are off, because those gloves are dirty and I don't want to get her linen dirty. Then I'll take away the bath blanket, and always take the bath blanket toward the feet so you don't pull their gown up. And that will go in the dirty linen with your pad. At this point, I'll raise the rail, lower the bed back to a comfortable height for the patient so that her feet will reach the floor whenever she wants to get out of bed. Make sure her call light is within reach. Lower the rails on both sides. Then I would discard all the dirties. The dirty linen will go in the dirty linen hamper. The disposable brief will go into the trash. When I'm finished with that, I'll wash my hands and report any concerns to the nurse.